Mariel is a 20-year-old woman recently admitted to the hospital for an asthma attack. The nursing student will perform a routine screening of alcohol use while his supervisor observes. The supervisor will give feedback to the student after the patient encounter. Watch as the student uses the SBIRT approach to determine Mariel's use of alcohol.
Hello, my name is Blake and I'll be your nurse for today. My supervisor will be observing me. So how are you doing?
Well, my breathing's a lot easier now. That was a pretty bad asthma attack.
Good, I'm glad to hear. All right. Is there anything else that you need right now?
No, I don't need anything right now.
Okay. Well, I need to ask you some routine questions that we just ask all of our patients as they enter the hospital. Would it be okay if I ask you those now?
Sure.
Okay. Well, first, do you smoke or do you use any tobacco products?
No.
Okay. And when's the last time that you had more than 4 drinks in one day?
Yesterday evening.
Okay. And finally, in the past year, how many times have you used an illegal drug or maybe prescription medication for non-medical reasons?
I don't do any hard drugs and I don't use other people's scripts.
Okay, good. So tell me a little bit more about your alcohol use. How often do you drink? What kind of alcohol do you like to drink?
Why are you asking me these questions? I'm not an alcoholic.
Oh no, I don't think you're an alcoholic, but I do need to understand your use of alcohol.
Okay, I drink beer on the weekends with my friends. I may have half a pack.
Okay, well thank you. I appreciate you answering these questions. Just to be clear, how much is half a pack?
6.
Okay, and what are the sizes of the beers? Are they 12 ounces? Are they 32 ounces?
I don't know. I mean, they're bigger than a 12-ounce beer.
Gotcha, okay. And how often do you drink with your friends?
Usually on the weekends after work, but we never do anything stupid.
All right, thank you. So I have a questionnaire here for you to fill out. You just take a few minutes and it'll help us better understand your health. Would you be willing to do that?
What's it about?
Oh, it's just a questionnaire. It won't take you too long.
Okay.
Okay, thank you. All right. Thank you very much. So I'll total up your score while I'm here. Okay, so is it okay if I tell you what your score means?
Sure.
Okay. Well, you scored a 15, which, according to the guide here, places you in the risky category. So it's called risky because maybe sometime down the road you may be experiencing consequences from your use of alcohol, such as heart or maybe liver problems. So what are your thoughts on that?
I mean, that's weird. I only drink on the weekends and I never drive. I don't know what I'm at risk for.
Good, okay. So you try and be careful with your use of alcohol. Well, let me show you one more thing. The recommended limits for women for drinking is no more than 3 per day and no more than 7 per week. It's lower for women than it is for men because women tend to have less water in their bodies, and so that leads to a higher concentration of alcohol.
Okay, I did not know that, but it makes sense.
Okay. So, what are some of the things that you like about drinking?
I mean, all my friends drink. I mean, we just something to do for fun on the weekends.
Mm-hmm. Okay. What are some things that you don't like about drinking?
I mean, not much. I mean, I haven't had any problems with it.
Okay. So it's a way for you to kind of hang out with friends and you really haven't had any problems so far. Good. All right. Well, I appreciate you answering these questions. And would it be okay if I share this information with your physician?
Sure.
Okay, good. Thanks. So I guess we'll...
As part of the medical team, the nurse can collect important information regarding substance use, provide brief patient education, and then document the encounter for the attending physician. The SBIRT approach is an effective tool for nurses to help patients at risk for alcohol and drug misuse.